page 19, you guys will see a stretch for the trapezius. All right. Now, trapezius again is commonly referred to as what type of muscle? What's the common name? What is something that a lot of people call them?
Trap.
Call their traps. It's also sometimes referred to as the coat hanger muscle. Okay, just because like what we talked about a little bit earlier in some of your anatomy classes, it's shaped, has that coat hanger shape. Okay. Now, because it has that coat hanger shape, we have to treat it as a bi-bellied muscle. Okay. The trap, depending on who you ask, which anatomist, the trapezius can actually be considered 3 or 6 different muscles, depending on which book you read, which anatomist. What's important to know is the boundaries of the trapezius, the directionality of the fibers of the muscle, so that when we do our stretches, we can avoid things like hyperextending the muscle. Okay, we can avoid things like causing more damage than what they're coming in to have fixed and replaced. Pardon me, repaired. Okay? So what we're going to do here, you can see this particular type of stretch on page 19 is actually designed with safety of your client in mind. Okay? A lot of you guys are going to use this particular type of stretch when you're working with clients who are maybe a little bit bigger than you are. So for the young ladies who, my little sister, for example, she's all of about 5 foot tall, 85, 90 pounds. And if she was to work on a big football player type, someone who's coming in at 6'2", 6'3", 350 pounds, well, his arms, his legs, his neck, his head, they're going to weigh a little bit more than maybe her hands can work with. All right. So to avoid the shakiness and making our client feel uneasy, we want to use techniques like this one so that we can use the leverage, which a lot of you guys have learned in your kinesiology classes, will allow you to actually do things that are beyond your normal physical upper body strength. Okay? Now, in order to do this particular stretch, what we're going to do is you're going to cross your arms, and depending on whether you're right or left-handed, is going to really determine which one of your arms is going to be on top. Okay? Now, for those of you who are right-handed, your right arm should be on top, which is going to give you the most dexterity and the most control so that we don't aggravate our client or in any way hurt their neck. Okay? What we're going to do is we're going to slowly lift the head. And one thing that I like to do, of course, is try to do a couple small little strokes here just to get the hair out of the way, especially for your clients with longer hair. And we're going to come down, and this is really nice if you have a stool this time. If not, you can just, of course, kneel down. You want to be in a comfortable position yourself. If you're straining your back, if you're straining your legs, your arms, if you're straining at all to do any of these movements, then you're going to end up hurting yourself. So it's very important that you take care of yourself so that you can take care of your clients. Now, from this position, you should be well into the massage by now, but we want to take notice of a couple things. You want to look at the position of the shoulders on your client, the position of her neck and head in a relaxed state. So you want to try to just kind of let that head float a little bit and see which way it's pulling. Now, most of us, because we have a dominant side, and we've talked about this in other classes, will actually have your muscles that pull you to your right or to your left a little bit. Some people might have small amounts of scoliosis or other issues. So we want to kind of notice these things. And just like at all times, throughout any massage session, consistently be noticing things about your client. That way you can continually tailor that massage. We don't ever want to go on autopilot for our clients, and especially not when we're doing things like sports massage. Now in this case, what we're going to do is you're going to reach under, and you're supporting the head at this point with your left hand. You're going to reach underneath and lay your fingers just above the shoulder. Okay, and basically you're going to be kind of getting up to that upper trapezius minor. Then you're going to come down, and with your other hand underneath, you're going to reach underneath your arm and get the same position here. Now, the idea here, if you notice, I have full control over her head. It's resting on my right arm, which, like I said, I'm dominant with my right arm. It's also in kind of the crook between where my upper hand is and where my lower arm is, so kind of where my wrist meets. And that is actually going to give me a position where I can manipulate her head almost as though I were gripping it with my fingers. Now, why is that so important? Why do you think? Ms. Vanessa, what do you think? Why would that be so important?
You always want to be able to control what's going on with the head.
Absolutely. And not just the head, but really with anything. If you guys start working on somebody's arm, on their leg, and clients that we work on, we tell them all the time, you want to be in a very relaxed state. You want to let me do all the work. I'll be all your muscles. You want to keep reminding them, because a relaxed muscle will let you work on it a lot easier than a tense muscle will. Okay? Especially with some of these athletes who are in almost a constant state of tension. Their muscles are always ready to go. So we want them to relax as much as possible, even though we're working on maybe invigorating that muscle. Now in this case, with the stretches, what's one of the main reasons why we don't want any tension in the muscle, if we can help it? What's one of the risks of maybe injury? Cramping is one. Hyperextending the muscle or causing a tear in the muscle. If we're not paying attention, if we're thinking about what we're going to do on the weekend, or if we're thinking about what we're going to do after work, it's very easy for us to maybe hyperextend that neck, hyperextend that trapezius, and maybe cause what layman's call a crick in the neck. All right. Now for us, that could be anything from a small tear, a sprain, it could cause a lot of other issues, and we definitely don't want to have our clients hurt on our tables. Okay? We want to take care of them. We want to nurture them. We want to improve their health, not diminish it. So in this case, like I said, we're going to go ahead and put that head just on my wrist. I'm going to come up underneath here. And essentially you're using your fingers more for balance than you are for pressure. Okay? This stretch is designed for the trapezius. It's not trying to get to the pec major, not trying to get to the pec minor. The fingers are mainly more for balance than anything else. So at this point, you can stand up if you need to, but you're just going to start lifting. And try to go very slowly so that you can actually feel how much the neck wants to give. Now, if you can only come up a half an inch before you start feeling that neck, then you can only come up a half an inch. Now, a lot of us, you're going to see with larger barrel-chested men and women, or with women who have larger breast size, a lot of times you're going to have issues with the chin getting pushed down into the sternum. Now, this is something that we want to be aware of, and just understand that it can be very uncomfortable for some people. So always, again, remind your client that, should at any time you feel uncomfortable or feel pain, please let me know so that I can go ahead and modify my treatment. Okay? Any questions?
No.
Awesome. All right. Now our next stretch here. All right, the next stretch here we're going to work is going to be the pectoralis major. Now the pec major is, of course, referred to as our chest muscle. Okay? Does a lot of work for us, especially with professional athletes. You're going to see these guys with these big pecs, and that's because they have to have very strong arms. They have to have very strong chest. Their breathing is usually much deeper and much more profound than the average person. So their chest gets bigger to accommodate the extra air capacity. Now, what we're going to do here is, again, you want to be very careful with draping at this point, especially working on your female clients. In this case, it's not quite as important because our client is dressed, but especially when you're working with clients who are in any stage of undressed, you want to maintain professionalism. So we always want to maintain that draping status. We want to take that arm and try to make it as close to a 90-degree angle as possible here. And one of the really, again, more important things about any kind of stretching, especially in sports massage, is maintaining control over the limb. Okay? In this position, it would be very easy, if I wasn't paying attention, for me to hyperextend and maybe do some damage to the rotator cuff, for me to do some damage here to the elbow, to the ligaments and tendons that come around this area. So we want to be very, very careful. But again, maintaining that control will also allow us to palpate and feel what's going on. Here on Miss Vanessa, one thing that we can notice is that she's very, very tight here around the thoracic outlet area, which usually indicates long hours of desk work, sitting in front of a computer, which, even though we're focusing on sports massage today, we don't ever want to ignore some of the other occupational or hobby type issues that could arise to any one of our clients. You know, they might be a football player, they might be a basketball player, but you know what? They might also work on home office, home business stuff. They might sit in front of a computer for hours on end. So we don't want to fix one thing and cause another problem. Now in this case, what we're going to do is we're using a small rotational force while simultaneously applying pressure to the pectoralis minor and upper third of the pectoralis major. How's that feel for you, Miss Vanessa? Good, good, good. And notice how I asked her how it felt. You know, one thing you want to focus on, especially when you're doing things like this, is your verbiage. You know, verbiage is something that can basically help a client feel very comfortable in you, understand and believe in your skills, feel confidence in referring you to friends and family members and coworkers. You know, there's a very big difference between saying, "Are you okay? Are you okay? Are you okay?" and "How's that feeling?" Now, as with all stretching, whether you're doing it on yourself or on somebody else, take your time. You're not in a rush. You want to give that muscle an opportunity to mold and form around your palm. And with time and with practice, you should actually be able to palpate the different layers of muscle. Wonderful. Now here with this wrist, one thing that I like to do is I like to grip at the wrist. Some clients will grip at the hands and the fingers. I find that gripping here at the wrist gives you a much better control over the arm itself. It also allows you to pull slightly, using the hand as a stopgap, which can add just a little bit more stretch to that range of motion movement. Now, as with all stretching, it's kind of nice to, I find, to just add a little bit more massage in there as well. Kind of between stretching sessions, it's almost like reps at a gym. You don't necessarily want to just go all out, stretch it like you got Gumby on your table. All right. Now, once you're done with your stretch, just like with the head, always return the limb to the appropriate position, nice and slowly. That way the client can feel at ease and stay relaxed. Any questions? All right, I think good to go.
Can you show me a leg drape?
Sure. Just a drape or?
Yep, just a drape.
No problem. All right, guys. Now, draping, there's several different ways to drape. One of the ways that's going to be very important for you, especially right now in your schooling, is going to be what we call the diaper drape. All right, the diaper drape is one of the safest, most commonly used draping techniques, especially with students right in school, mainly because it's 100% secure if done properly. Okay. Now, what I do is a slightly modified diaper drape, and of course, you know, once we're in class, I'll do whatever the school wants me to teach. But what we do is we're going to use kind of a fanning technique. So what I like to do is, first of all, make sure your sheets are straight, that all your lines and creases are as straight as can be. That way you don't have to worry about tangling. I like to reach down and grab the edge of the sheet with my right hand, come down and find the edge approximately where the hip is going to be. And what we're going to do is we're going to fan in. Now, I'm